Medication management means taking an in-depth look at the health of the person and making sure your health care is optimized for each condition that you have and for each condition for which you are deemed to be at high risk. If you have diabetes, the medication management process would be to ensure that you are receiving the right medications for your diabetes. Not too much, not too little, and just the right medications. Things we look for during the medication management process are making sure all adverse effects and drug interactions are minimized, making sure that you're not taking too much of a prescribed medication, which could be that the dose is too high or that you are taking a medication that your body no longer needs. And we also make sure that you're not taking too little of a medication that is indicated for you, which could be that the dose is too low or that your body needs a medication that has not been prescribed for you. It is recommended that you should meet with your pharmacist or your primary care provider once a year to make sure that what you're doing on a daily basis to care for yourself is in sync with your long-term health goals, and to assess that your medications are working for you. Barriers to medication management can be a lack of communication. If a person doesn't know why they've been prescribed a medication, they may not recognize the value of the medication, and they may stop it without telling anyone. If you don't know why you are taking each medication that has been prescribed for you, please ask your healthcare team. Taking medications can be complicated. Remembering even to take the medications and then remembering to order them from your pharmacy can be a lot of work in addition to one's busy day. If you are finding you are having difficulty remembering to take your medications or difficulty knowing how to take your medications, there are ways we can try to make taking medications easier. Another barrier to medication management is not being able to afford the medications you have been prescribed. If you are in a position where you cannot afford your medications, this is real. Please speak with your prescriber or your pharmacist or any members of your healthcare team. We would look at ways to reduce medication expenses and use community and other resources. Medication mismanagement ultimately leads to the person getting too low a dose of a medication that their body needs, too high of a dose of a prescribed medication, or adverse effects from a medication. To prevent medication mismanagement, for each medication you have been prescribed, please know, why have you been prescribed the medication? What are the benefits of each medication you have been prescribed? Knowing why you have been prescribed a medication is important so you don't accidentally stop it when you think you no longer need it, which would be an example of receiving too low a dose of a medication. How should you take the medication? Taking medications at the wrong time of day or with the wrong foods, or taking medications at the same time as other medications, depending on the interaction, can lead to any of the possibilities of too low a dose, too high a dose, or adverse effects. What can you expect from the medication? What should you look out for? When will you notice the benefits? And what kind of side effects are there? What should I do if I experience any of these side effects? If you are experiencing side effects, please reach out to your prescriber or your pharmacist so that they may help you make an informed decision as to what is the next best course of action. There are several supports and resources available to help people manage their medication. There is a dosette system where you can prepare your meds weekly. These systems are fortunately quite inexpensive. You still have to remember to take your medications, but you would know when you forget to take your meds. A slight improvement from the basic dosette system is a dosette system with built-in alerts and timers which can be set to remind you to take your medications. Many pharmacies offer a multi-dose dispensing system, often in the form of blister packs. So rather than getting your medications in vials, it would come in this weekly blister pack. In addition to helping you keep track of your medications, some apps will have a reminder that you can set to alert multiple times during the day to remind you it's time to take your morning, lunch, and supper, for example, medications. Some apps will also allow a caregiver to receive notifications when the person that you're caring for has confirmed that they have taken their meds. Finally, there are home medication dispensing systems where meds are pre-packed and only released to the person from inside the dispenser at the exact time that the medication is supposed to be taken. At the same time that the medication appears out of the dispenser, there is an alert that reminds the person to take their medications. Time and range is a way we can check how we're doing with our sugar level management because it gives us information about how our sugar levels compare to our long-term glycemic goals. Time and range complements A1C, where A1C reflects sugar levels over the last 3 months with weighted emphasis on the sugars of the most recent last month. Time and range can support more immediate decisions so we can stay on track and ask for help from our diabetes healthcare team sooner if we find our time and range patterns are not where we want them to be. For most people with type 1 or type 2 diabetes, we define in range between 3.9 and 10.0 millimoles per liter, and we want the time in range to be more than 70%. While these are the targets for most people with type 1 or type 2 diabetes, you might have other medical conditions or other circumstances which would indicate different targets for you. Time in range is best used with looking at the individual daily glucose patterns and other metrics, like when we superimpose several days of glucose data on top of each other. Well, what does the shape of those curves look like? Are they flat, narrow, and in range, which we know leads to better health? Or do our sugars swing up and down during the day and we have high variability, which is not as safe? We can use this information to help us make decisions not only about insulin, but also about food choices and exercise, sometimes even giving us details about the timing, frequency, and intensity of the activity, as well as helping to inform decisions about other blood sugar lowering medications. For most people with diabetes, we do not recommend stopping or decreasing insulin or any other glucose lowering medications, even if your blood sugar is in your target range. This is because it is the existing doses of medications balanced with your daily food choices and activity that have made it so that your blood sugars are in your target range. Also, there are some medications for diabetes that do more than lower blood sugars. For some medications, in addition to lowering your blood sugar, they may be helping with weight management support and also protecting your heart and preventing heart attacks, strokes, and deaths from heart disease. Some of these same medications can also protect your kidneys and prevent heart failure. If you continued to eat less and perhaps you continued to exercise more, perhaps you started to lose weight. In these situations, the balance is such that your body now needs less insulin and other medications to stay in the target range. So then yes, we would adjust the dose of medications to balance what your body is telling us it needs to keep the sugars in the target range, and so you don't go low. Another situation when we would consider stopping or decreasing certain glucose lowering medications is when the person has chronic kidney disease. In this situation, once the person's kidneys have reached a level where they can't clear the medications as well as before, then we would reduce the dose of some medications. Even when a person with type 2 diabetes is able to achieve blood sugar levels equal to diabetes remission, it is not automatic that we stop insulin and or other blood glucose lowering agents. Many medications that can be used to lower blood glucose also have favorable weight management benefits. can prevent heart attacks, strokes, and death from heart disease, and can protect the kidneys and prevent heart failure. So, if a person with type 2 diabetes is able to achieve blood sugar levels reflective of diabetes remission, before we stop or reduce certain medications, we should assess the person for their overall health risks and identify any preventable poor health outcomes. Never stop your insulin or other blood glucose lowering agents, even if you have blood sugars in your target range, without first speaking with your diabetes healthcare team. By speaking with your family doctor, your nurse practitioner, your pharmacist, or your diabetes education team, you can be engaged in your own healthcare and make an informed decision about what's the best plan of care for you.